Hello friends. In this video, we are going to discuss about building blocks of cognitive behavioral therapy. That is thoughts, emotions, feelings, sensations, and behavior. How they are interlinked and how they need to be understood in the background of cognitive behavioral therapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only, not for clinical opinion. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss about the interlink between the thoughts, emotions, physical sensations, and behavior. Further, how does these factors are interlinked and how they have impact in cognitive behavioral therapy, and how to teach our clients this interlink between all these important stakeholders. This video is targeted to psychiatrists, doctors, nurses, mental health professionals, psychotherapists, and counselors. Cognitive behavioral therapy. In cognitive behavioral therapy, it is based on the cognitive model of mental illness developed by Beck. The cognitive model hypothesizes that a people's emotions and behavior are influenced by their perception of an event. That means how the events are perceived. The feelings and behavior will be contingent upon that. How people feel is determined by the way in which they interpret the situation rather than the situation per se itself. That's what the Beck made an important observation. Let's understand by an example. There is an event. Because of that event, there is an immediate responses and emotions. For example, my boss yelled at me and I became angry and later sad. I realized I can't do anything against my boss. I became helpless and I became sad. But the issue here is, how did I perceive this illness? Why did he yell at me? That is the issue need to be understood. But the issue here is, how do you interpret that event? That matters most. I felt I'm useless. I'm good for nothing. I'm stupid. That is the reason my boss is yelling at me. That is the reason emotions. Here, the issue here is more than the event per se yelling at you. The issue here is, how did you interpret that event? That matters most. You feel the way you think. That means the Burns clearly said, the event doesn't matter. How do you perceive? How do you interpret? How do you think about an event matters most. One more example I would like to give you. There are two men, Mr. X and Mr. Y. Both are interested in a same woman, Miss B. So both want to propose Miss B for a date. The first person, Mr. X, goes to Miss B and says, "Shall we go for a date?" Miss B says, "No, I cannot come with you." So Mr. X goes away. Now the Mr. Y comes and proposes Miss B for a date again. Again, Miss B says no. So both of them have been rejected by Miss B. Now let's understand how Mr. X thinks and Mr. Y thinks. If Mr. X thinks, I'm not good looking, I do not have money, I'm not tall, I'm not handsome, so nobody loves me, even my father and mother did not like me, and he goes into a depression. On the other hand, if the Mr. Y thinks that, no problem, next time, I think she is busy, or else she may have a boyfriend, maybe the God may have a different plans to me, and he doesn't goes into depression. The event is same, but how do you interpret that event matters most. That is what is cognitive behavioral therapy all about. And let's understand the building blocks of cognitive behavioral therapy. Cognitive triad, cognitive distortions, cognitive schema, automatic cognitive thoughts, and environment. Here the issue is cognitive triangle, that is 5 important stakeholders. To understand that, we need to enter into the basics of cognitive behavioral therapy. Here, there are 4 important stakeholders have been mentioned. Thoughts, feelings, also called as emotions, and physical symptoms and behavior. So each one of them are interconnected. One influences the other. But however, there is one more important component, that is environment or the event. These events will trigger the thoughts, and that thoughts will have an interplay with the feelings. And because of the thoughts and feelings, there will be certain physical symptoms and behavior. But however, these each individual stakeholder influences the other directly or indirectly. That needs to be understood. And the physical sensation, it is very difficult to understand. Hence, I have given this diagram here. Physical sensation, for example, if a person has to give a public speaking, that means he has to give a speech. And at that time, he feels that he is not complete. He feels that he is going to make a mistake. People will laugh at him. At that thought, the thought of he will make a mistake, people will laugh at him. And he has the emotions, anxiety attack. And during this anxiety attack, he will have this physical sensation. What are those? Difficulty in concentration, thought block, tremors, stammering, heart increased palpitation, sweating. At the same time, restlessness, tingling sensation in the extremities, dry mouth, feeling that he needs to go for urination very often. So these physical sensation, again, he focuses on that, the anxiety further worsens. That means it becomes a complete circle. And because of this, his behavior also becomes very erratic at that time. So understanding the relationship between thoughts, feelings, behavior, physical sensation matters most in a particular event. That is what is all about cognitive behavioral therapy. And physical sensations are commonly seen in various disorders, anxiety disorders, social phobia, agoraphobia, and panic disorders. In such a scenario, the anxiety-related physical symptoms are seen. Whereas in persistent somatoform pain disorder and somatization disorder, the person will have constant pain, maybe headache, body ache, and these aches will be completely different and they do not have any clear-cut organic pathology obviously seen. Further, in hypochondriasis, BDD, OCD, there also you're going to see certain physical sensation whenever the symptoms are triggered or the anxiety is triggered. Now the question is how to make understand our client about these factors. As a therapist, you know it. Now you have to explain your client. How do they interact and how do they play an important role in your symptoms? Let's put this chart directly to the patient or the client and say there is a situation or an environment. Because of that event, the thoughts are triggered and these thoughts will influence directly the feelings. Feelings and thoughts will directly have impact on the physical symptoms and the behavior. Let me give one example. 21-year-old Mr. Raju, preparing for his degree exam, is finding difficult to concentrate in his studies and he is having a headache. On analysis of his thoughts, you can map his thoughts, feelings, physical symptoms, and behavior. Here, the event is preparing for science exam. He has to prepare now, but he has a thought that I will not pass in the exam. And because of this, he has a feeling, anxiety, feeling, sad, frustration. And to do that, along with this, he has a physical symptom. Because he's unable to concentrate, he has a headache. And because of that, what he does is, he will avoid studying. He will play computer games. And that leads to an important event. He fails in the exam. Once he is failed in the exam, his thoughts and beliefs are confirmed now. And this becomes a vicious cycle. That needs to be explained how thoughts, emotions, that is feelings, physical symptoms, behavior play an important role whenever there is an event. Further, one more important example I would like to give you. 30-year-old Miss Radha, married housewife, educated up to post-graduation. Since past few months, she is having a generalized body ache and becoming angry very often. On analysis of these 5 factors, the situation is husband comes home late and she has a thought, he does not love me. He may be having an affair outside. And she has a feeling angry and she feels uncared, unloved. And because of that, she has generalized body ache, fatigue, and feeling of weakness. Because of that, she starts fighting with the husband as soon he comes from the office. Since she is fighting with him very often, the husband prefers to come late home. And when he comes home late, further her beliefs are confirmed that he does not love him. And she feels that she is not cared for. So this is how the information needs to be explained to the client. And how best way is to do that is having this 5 column. The 5 column, I'll be explaining it, but you need to understand one important things. Emotions are the royal road for cognitions. Whenever there is a catastrophic emotions or a outburst of emotions is there, that means there are faulty cognitions, cognitive distortions, or maybe cognitive schemas which need to be unearthed and to be corrected. Let's understand about this 5 column chart. This chart needs to be done on daily basis. It is also called as thought diary. If you are able to explain your client and if they learn to chart this on daily basis, they'll be able to understand the relationship between the thought, events, emotions, sensations, and behavior. Once they're able to understand that, you can show the recurring patterns, recurring themes, and what are the cognitive dysfunctions which are there in them. Let's move into this chart. First column is time event, or else whenever there is an event which triggers an emotion, that needs to be charted, that needs to be documented. That is, we call it as journaling. If they are able to journal that, if there is an event, that event triggers a thought. And because of that, he has a feelings, that feelings which are negative in nature, or else sad, angry, frustration, feeling guilt. Those kinds of feelings need to be documented here. 0 is neutral, plus 10 is positive direction, feeling happy, feeling loud, feeling cared. Whereas minus 10 is feeling uncared, neglected, abandoned, depressed, angry, irritability. That needs to be documented here. Whether it is -5, -4 needs to be journaled here for an event. Here the boss is yelling at him and he feels the thought he doesn't like him. He's targeting him. So that is the thought he's getting. And he's documented the feelings. Further, sensation. He's having palpitation. He's having tremors in the hand. He feels that he wants to go and hit his boss. Those sensations needs to be documented. And finally, the behavior. That is shouting at the boss or becoming angry with other people also. So this needs to be documented on daily basis, on maybe every 3 or 4 times a day, or else whenever there is a issue of emotional outburst, that is the time you need to document, journal it on every day basis, if possible 3 to 4 times a day. Initially to start as a structured way, slowly over a period of time make it in a semi-structured. Whenever there is emotional outburst, he is going to journal that, so that that can be discussed during the therapy period. And this thought diary is very essential. And studies have clearly said that if the patient is able to be comply with this thought diary, is able to journal them on daily basis, and is able to bring that diary to the CBT sessions and is able to discuss them, that means there is high possibility he will be get cured with this problem, with this psychiatric illness. That means homework compliance and complying with the thought diary matters the most. And this documentation is very essential. And this documentation makes him understand about the thought, feeling, physical behavior. And daily charting will help him out, how he is progressing. And you will also be able to pinpoint the repeating themes. The previous week, this week, and exactly one week back, how these themes were coming into his picture. And he's able to make the important identification of his distortions, core belief, and automatic negative thoughts. And if he's able to document that by journaling, he'll be able to show how he has improved over a period of time, maybe 3 to 6 months. That documentation is very essential. That will give him a evidence how his CBT is progressing. To conclude, my dear friends, cognitive behavioral therapy is considered as a second wave of psychotherapies. They are very effective in nature and they are highly evidence-based. And you need to understand the way you think is the way you feel. And to feel better, one need to change the way we think. That is essential. Thank you very much for giving your valuable time. Stay safe.